to give people a few minutes to join, and then we'll make a start.
Jaron Demi.
Okay, we're going to make a start in a moment, just to let you know that you will be muted and we can't see you, but hopefully you can see us. And obviously there is an opportunity to pop in the chat should you need to ask any questions. So I'm going to make a start, as it's a few minutes past. If I just kick off, I'll introduce myself. My name is Karen Bonner. I'm a chief nurse and I work at Buckinghamshire Healthcare NHS Trust. I lost my dad, Egbert Bonner, to prostate cancer, just 3.5 years shy of his diagnosis. He was diagnosed with metastatic prostate cancer. So since then, I've been working with Prostate Cancer UK to raise awareness of prostate cancer, particularly in the Black communities. We know that Black people as a whole suffer health inequalities, both in society as a whole and in the health system. But we need to develop a unique understanding of Black people's communities and their needs. And so today is a really good start to what I hope to be many conversations. We know that our work here at Prostate Cancer UK is really, really pressing. What we do know, and I'm telling many of you that may know this already, is that Black men, 1 in 4 Black men will be diagnosed with prostate cancer. That's a staggering number. And like my dad, 1 in 12 of those men will go on to die of prostate cancer. And that's in comparison to their white counterparts, who are 1 in 24 if you're white, and 1 in 44 deaths will be caused by prostate cancer if you come from the Asian community. So those statistics alone will show you the disparities that we see and hear amongst Black men. Despite all the challenges and the increased risk, we're still not seeing as many men as we could do coming forward. And so today is really here for us to talk through what we need to do in order to really share with you what we've agreed, a stronger messaging for the Black community, to get tested and to really understand what we think the cultural barriers or any communication barriers that we have to men getting tested. And we're going to specifically talk about the PSA test, which many of you know will be the prostate serum antigen test. So I think I want to share with you how I feel, and we'll hopefully explore that over the next hour, that I'm really proud of the work that we've done so far. There is still more to do, but I think that we've done a really positive step forward in improving the message. And I just want to share with you that in 2022, just last year, Prostate Cancer UK brought together a number of people, and you would have seen the picture earlier. And in that picture was a real collection of individuals from various backgrounds, stakeholders, patients, people suffering with prostate cancer, and policymakers and other stakeholders, including the health service as well. And we work together to really discuss what we think we need to do to really create a stronger messaging for Black communities. So we talked a lot in that event around the cultural barriers, why men, Black men in particular, do or don't engage with the messages that are out there, and what we could do to really better engage and build trust across communities. And many of the things we talked about is how we could better build alliances. We've got many community support out there, and there'll be some people in this room, hopefully today, will be from those individual groups, but also how we can better work with schools, universities, colleges to really start to talk about men's health and just to normalise the conversation. It's really important that we start to do this. So thanks to everybody that joined. It was a really good day, and what we got out of that day I want to share with you. It was a really great day with lots of minds coming together, and that led to the issuing of a new statement that came out, and I'm going to just share this with you. It was published towards the latter part of last year. So the statement reads, because Black men have double the risk of prostate cancer and develop it younger, we strongly recommend that you talk to your GP about a regular PSA test from the age of 45. As Black men, though, if you are worried about cancer, you should speak to your GP at any age. The other thing to note, that if you have a family history of breast, prostate or ovarian cancer, then you are at higher risk and you should consider a PSA testing earlier than the date that was stipulated. This is a big change in our messaging, and I, for one, am very, very proud that we've got to this consensus through the workshop that we ran with those individuals that you saw in the picture, because I think it was really an important step forward and a response to previous feedback that the messaging was not clear enough. We've been very specific and targeted so we can speak directly to the Black communities and specifically directly to Black men or those of mixed heritage as well, because it's really important that you come forward and that you are tested. Now, I think what's important is that we start to really share this message, because I think, you know, it's fine for us to have agreed that, but we want to get this message out there and we want to really start to engage communities so that we can start to really, really ensure that our GPs and other colleagues across the system support this message as people come forward. So today I'm honoured that we're joined by a number of health professionals, researchers, clinicians, community leaders, educators, but most of all, importantly, men living with prostate cancer. So today's webinar is the start of what we hope to be a really fruitful conversation and an ongoing conversation. So I've got some people with me, so I'm not on my own today, which is great. So I want to introduce, if I may, a couple of people who are going to join me so that we can really start to share the knowledge and have the dialogue. And if you've got questions, then I think it's important for us to share them, and I'll be able to hopefully have some time towards the end. So if I can introduce Dr. Bunmi Alajide. Welcome. Dr. Bunmi, can you just introduce yourself and just tell everybody about the work that you're doing as well? And then I've got a few questions, if I may, that I'll pose to you so we can have a little discussion.
Thank you, Karen. Yes, my name's Dr. Bunmi Alajide. I'm a GP. I work in the Romford area in Havering, that's outer London. I'm a GP with special interest in cancer, and more recently, one of the prostate cancer clinical champions. The work I do is around prostate cancer. It's looking at getting follow-up for men with prostate cancer well into the communities, but also, very importantly, part of what I'm doing today, raising awareness amongst Black men and looking at how we can improve the messaging with regards PSA and prostate testing. So yeah,
Wonderful.
that is me.
Wonderful. Well, you know, I'm really delighted. We've met before, so I've got the privilege of having met you at the Census Workshop. So, and you're doing some amazing work. And I think what I'd really be curious to understand from you is, why did you get involved in this piece of work? Why is it important to you?
So for me, the whole journey with an interest in prostate cancer started around 2016. And it was when I took up the role of a Macmillan GP. So locally, we was looking at kind of managing and improving kind of early diagnosis with cancer generally within the Havering area. And one of the very first projects was actually also getting to get men have the monitoring of their prostate cancer brought to the community. But that's not been the only thing. And over the years, my interest have drawn from that, which is kind of prevention and early diagnosis with cancers, to looking at prostate cancer in a different light. Being a Black male myself, trying to increase awareness within people who are like me, and also looking at ways to improve health-seeking behaviors also. And also as an individual myself, someone who's had loved ones and who currently have a loved one affected by prostate cancer. So there is that personal connection, and that's the drive for me. Yeah.
Yeah, thanks. Thank you for sharing that as well. I know that's very personal, and just having quoted those stats earlier, it's unsurprising that many of us don't have people. We will always have people in our family or friend circle, and that have been diagnosed with prostate cancer. So thank you for sharing that. I know that's very personal to you. So I mean, how does this play out for you in practice? When you're a GP, and we're you know, and speaking to GPs in this forum is going to be really important. So how does it play in practice, and what do you see different about Black men presenting to you than other groups of men?
I think in practice, it is the usual. The only thing I would say is, and you touched on that, Karen, is I do see less of Black men with regards to presentation in the practice, and that's not Romford being an area where you have a small number of Black men. We do have a quite sizable Black ethnic population. But that links to what you said about kind of those cultural or the factors that I might have noticed. And one thing I noticed is access to care for Black men generally. And that's affected by a number of factors. Health inequalities, you did touch on. And we know Black men, older men, and those living in deprived or low socioeconomic areas, inequalities are higher in those groups. And so that's one factor. Another factor is generally what I've heard from colleagues who kind of work, or friends who live in areas where you don't have a high population of Black men. What cultural competencies, and that's their ability to just understand and interact effectively with people from other cultures. And that affects access in some areas also. What I've seen also is faith and religion, generally as Black men, especially Black men who've migrated, they hold very strongly to their faith. And that's a factor also in presenting. And it could be this feeling that I am well, I am fine, there's nothing wrong. There's also kind of what we know generally, the distrust with the medical community and the research community. And that, I think that's been for a very long time. with histories, we won't go to this happened in the past. So there's some distrust from Black men generally. The other thing I would touch on is what I kind of term a reduced risk perception. And I'd explain that. So generally, we know with prostate cancer, especially with early stages, you can have the man with no symptoms at all. And so that needs to present at the doctors, it's not there. And men generally, but we were talking about Black men here. I think also education around and awareness around symptoms other symptoms that could be linked with prostate cancer. And one in particular, because I've had a patient with that, is, for example, erectile dysfunction. So rather than linking to say this might be a symptom that there's something wrong with the prostate, it's generally, it could be linked with stress or the factors. And also, talking about that, there was this research done in 2020 where they looked at where Black men are of their risk for being Black, because we know being Black is a risk on its own. Mm-hmm. And well, it was a small sample, 300 Black men, but only 20% knew that just being Black was a risk factor for having prostate cancer. So those factors do play in, and I think generally, again, something you touched on, kind of more subtle but very important, is that factor where there are other links to prostate cancer that we're not aware of generally. So men who have a family history of breast cancer or ovarian cancer, and generally not knowing. So yeah, that's why I see play out in practice.
Yeah, that's really helpful. And I suppose just reflecting on that, given what you've mentioned about how Black men may present or not present, what sort of conversations do you have within your professional groups? You're a GP, and we've got a few questions already coming in about reception for GPs when they're actually, people are presenting and saying, look, I've got a family history, or I feel that I might like to be tested. What sort of conversations are you having in your professional groups?
So the discussions generally traditionally been on what guidelines we have, but we know things have changed. And for kind of those of us who are opportunity to either have an interest in cancer or engage with Prostate Cancer UK, or just being Black and being aware of those increased risks, those discussions go on in trying to get other colleagues more aware and make sure that they're aware of what the guidelines are, but also what changes could be coming into play, and looking at PSA testing as in how it affects Black men and the importance with regards Black men. So yeah, those discussions, we do have them, educational sessions for younger doctors, and actually non-doctors also, so allied clinical specialists like the nurses and our HCAs. Yeah.
Yeah, I think it's really important, isn't it, as we've changed the message, is how we're getting that across to our GP colleagues. A couple of things in the chat already. One of the questions raised about an individual who's personally gone age 50 to their GP practice, doesn't have a family history, but was turned away, reluctant to give the PSA testing. What would you say to that individual, or even that GP? This Black man's shown up at 53 and very keen to be tested and turned away.
Yeah, so I think education is key, but also it is power. So I would say to the gentleman, it's going back to the GP with that information in hand. Say generally for Black men, it's actually 45, because we're at higher risk. And I think it's just that push. And I've told friends I've spoken to generally to say, I'm really sorry, it's not I'm teaching you your job or something, but you might want to check the Prostate Cancer UK website. It's those subtle messages, a push to say, I am actually in some ways entitled to this test, and that decision, it should be an informed decision. So it's going back to the doctor and letting them know. Yeah.
Yeah, thank you. I mean, I agree with that, because I do think this message now that it's available on the prostate cancer website can be used as a powerful tool and vehicle. So hopefully you'll be able to take that back and speak to your GP. I'll come on to a couple of questions in a minute, but I'm really keen for we were both part of that workshop, and I just wanted to ask you to tell us a little bit about how it was for you. How did you consider the evidence, and coming away with that statement, how that felt for you as a GP?
So the workshop was really it was stakeholders meeting, and with one kind of everybody looking at one thing, and that was improving the message for PSA testing. And it was a black a black consensus workshop, we did call it. So we had men living with cancer, men who've survived prostate cancer, men and women with loved ones who've had prostate cancer, healthcare professionals, secondary care, primary care. We had researchers there, and local grassroots charities. So it was really everybody coming together. For me, it was an opportunity to actually listen and learn, because as a health professional, especially as a GP, we're kind of like the gatekeepers, and the message did filter through quite clearly about where it's almost like we've been the hindering block to patients having their PSAs tested. And for me, it was an awareness, and I could take that back to my colleagues, and even took it back to the GP trainees under us, to say, this is how our patients feel. I think the outcome of that consensus, and the fact that PCUK were able to actually put out a statement, for me, it's also quite empowering. What I also got from the workshop was that a clear indication that there is a push to actually look into and address the guidelines based on new evidence we're having, especially as it affects Black men. So all in all, it was a really good workshop for me. Yeah.
Yeah, it was. I felt very privileged to be part of that as well. Can you just tell us, we've got another minute left, but there's questions come in around the accuracy of the PSA testing, and why do we not just have a regular screening program? Are you all right to answer both of those if you can in the last minute or so?
I think I hope to just put it in simple terms. So yes, the PSA test on its own, the way things are now, it's not considered a screening test. Okay. However, it is what we have now. And we do know that it does pick up cases with prostate cancer. Research is going into even things like having a baseline test and then monitoring. So even those who have a normal baseline test, you could check progression. And we know elsewhere around the world, especially in Europe, that's been looked into and applied. The guidance is it has to be an informed choice for men. It is what we have. And I think if men come in and say, I'd like to have my prostate checked. We know PSA test is what we have, and they raise anything concerning risk. So either the ethnicity being Black, age over 45 for Black men, men with family history, especially Black men with family history, then really strongly, it's what we got, and I think the test should be offered.
Yeah, agreed. And we'll probably come on to a bit more of that in the last bit of the Q&A, which I know you will rejoin us. And I agree. Just touch on to the new statement. I think that will help massively. So thank you so much. we're gonna come back to you as well later on for more Q&As. But firstly, I just want to thank you for those sharing your own views on those questions and points, and for answering those questions for individuals. Thank you very much. Okay, I'm just going to move us on, and I've got a couple of other people with me today. So if I can welcome Patrick Williams. Patrick, are you there? I'm going to get you to introduce yourself, if I may, and then I'll come on to Emeka next. Thank you, Patrick.
Hi, I'm Patrick Williams. What else do you want to know?
What do you want to share with us? Just tell a little bit about yourself, just a little minute, and then I'll come on to get Emeka to introduce himself.
Well, I'm 66 now. I know I don't look it, but but I was a professional dancer in a former life, and I went on to lecture to become a senior lecturer in dance and music.
Wonderful. Thank you for even I've learned something new about Patrick today. I'm going to have to get him to do some dancing a bit later, but Patrick, thank you. And Emeka, I'll just get you to introduce yourself as well, if I can, please. Welcome.
Hello, thanks, Karen. Yeah, so I'm Emeka. I'm a senior project manager working in the transport industry, and I'm also based in Havering in Greater London. So I've been affected by prostate cancer through my dad. He had prostate cancer and passed away in 2020. He was 69 years old at the time. And since then, through an organisation set up with my sisters, it's called Prostate Cancer Black Men, we now campaign to encourage conversations around prostate cancer, especially within the Black community, and increasing awareness amongst a younger demographic as well. So we primarily aim to support prevention and early detection. And yeah, very proud to have been involved in this initiative. It's been facilitated by Prostate Cancer UK.
Yeah, wonderful. Thank you for sharing that. And like me, your memory, I'm sure your dad would be very proud. My dad was 74 when he died. It's way too young, isn't it? 69 and 74, really. So yeah, it's great that what you're doing, both of you. So tell me, why did you get involved? Patrick, I'll start with you. Why did you get involved? You might want to share a little bit more about why you got involved with this particular project, because you were part of the Centre's workshop, so it's important.
Yes, I was. I was diagnosed with advanced metastatic prostate cancer in January 2020. I felt it was very important for me to put some markers down here, because it was there were lots of things that were missed in my case. In fact, actually, I was diagnosed as stage 4, right, and had a terminal outcome. I've outlived that at the moment, but I wouldn't have got to this stage if at the time when I was diagnosed that there was some sort of statement that was to say that men of color like myself should test at 45. Now, unfortunately, that wasn't there, right? Now, I don't want another man to go through what I have been through. I don't want another man to realize that he has to go and tell his children or his, well, in my case, I have sons, to go and let them know, right, that I've given them a ticking time bomb. I don't want that to happen. So this is one of the reasons why I'm involved with this, because it is so important that Black men go and test, get up and do that. And I know that there's lots of, and I do a lot of talks, and I know there's a lot of things about, you know, oh, if we have to go and do this, you know, they're going to have the finger, you know, and to be honest, that's less than 5 seconds, right? I would do that any day than to have to go and do a biopsy, because I found that the most disgusting thing I ever encountered. But So yeah, so that is where I'm coming from. I'd like to see more men being able to feel confident to go forward and be tested.
Yeah, thank you, Patrick. And I'm sure you've done that already in all the great work that you're doing. Emeka, what about you? Why? I mean, you've already mentioned your dad, and clearly that's a huge influence factor, I suspect. But and you know, what made you decide to just get involved?
Yeah, so just a bit of background on my dad. So he had advanced symptoms in 2017. And like a lot of men, he didn't go to the doctors for anything unless like he really, really had to. So when he eventually did go, the diagnosis came back, similar to what Patrick had mentioned, stage 4, it was terminal, but it was also very, very aggressive. And frankly, in my dad's case, it was caught too late. So all they could do was prolong his life as much as possible by preventing or trying to limit further growth and spread. So it was a very, very difficult period for dad, various complications during treatment, particularly towards his last year, but also for the family as well. So myself, my sisters, my mum, we gradually saw someone who was so independent and strong become so reliant on us, and also the end of life care team for pretty much everything other than breathing. So things were compounded by the lockdowns during COVID. So we couldn't really physically be there with him as well in his last days. So then after he passed away, that's when I learned, or I started to do a bit more research myself. And that's when I learned that my risk was increased. It didn't happen straight away. You know, it took a lot of poking and prodding for myself to take the initiative. And I'm not of the typical age that one might expect to be affected, but I'm certainly not too young to be informed. So from an early detection perspective, from my perspective, you can't rely on symptoms. Not everyone gets them, as it's been mentioned already. And as in the case with my dad, it was too late for curing. And doing the research, everything pointed towards PSA testing as the first real indicator for early detection. So it's certainly not perfect, hence there's no national screening program at the moment. But in my opinion, it's effective enough for those who are most at risk, including Black men. So I just wanted to be involved and to spread that knowledge really and awareness for people like myself so that they can be better informed about their risk and early detection methods.
Yeah, well done to you. And I think it's really important, particularly as a young Black man, to engage with people of your age group, like you say, with a family history and so forth. So I think well done to you. In fact, very similar story to my dad, who was diagnosed way too late. And I suppose if we'd all had some testing a bit earlier, we might be, their outlooks may be different. So Patrick, tell me, how did you feel during the workshop? What did you feel was good about that event and what you got out of it?
Well, it was very interesting because as I sat in that workshop, there were lots of men that were there who either had their prostate removed or were people who were on watch lists that were diagnosed with prostate cancer, but it hadn't got to the stage where they had to have any sort of intervention. And I felt somewhat alone because there was I sitting there with advanced prostate cancer and feeling completely, out there on a limb until Emeka and his sister spoke up about their situation, and yourself, Garrett, The interesting thing is that I knew Emeka before that because I had encountered him, or should I say he got in touch for me to come and give a talk where he was stationed. But I can't remember him telling me about his dad at that time. So it became quite interesting to learn that I was not the only one, but still we were in a minority amongst the people that were sitting there, right? Because, and in some cases I felt quite jealous because people were now beginning to relive their lives in a situation where they had them removed and they moved on. Yes, there were complications, but the death sentence that was over my head wasn't there on theirs. And I felt really alone you know? And sometimes, you know, I just felt, well, okay. But then the strength came for me when I realized that some of the stuff that I was doing in terms of going out and giving talks allowed me to share my experience of living with prostate cancer. And I use the first part of that very carefully, living, because I'm not dying with prostate cancer, right? I am living with it, right? And that became the thing to move me on and to move me forward. And that workshop allowed me to see that I was in a unique position, because I was coming from a place where this was something that could happen to men if the testing and that idea that we had put a marker down, a very important marker that was coming out of Prostate Cancer UK, saying that it was advised that Black men should test at 45, you know? And this was wonderful news for me, because it came late for me, but it was wonderful because I knew that other people would benefit from this. But by the way, I have no intentions of leaving this world. So I can tell you right now that I'm going to see this through right to the end.
Well, we're right alongside you, Patrick, all of us. So we're with you. We're with you.
Okay.
So thank you so much for sharing that. And that's
problem.
the thing about that experience on that day, the amazing work that we managed to do just in that short, and how powerful it was for us all coming together. I just, you've already mentioned, Patrick, what it really means for the community. Emeka, what do you think this statement really means for the community? Now we're trying to get the message out there, and today in particular is the start of more conversations to be had. What do you think?
So for the community, I think the change could mean a lot more for everyone that's obviously high risk, Black people in general, being informed about their risk and being confident to talk with their GPs about PSA testing and next steps. So for me, it's also about that message resonating with key individuals within the community. So if this isn't necessarily something that will resonate or land directly with someone who is most at risk, then maybe it's something that will resonate with somebody whose word or opinion that they value. So like your partner, your children, friends, pastor, teacher, so on, you know, but it's the potential to create that ripple effect with key individuals who can translate that message. And yeah, I think I'll just leave it there for now.
Yeah, I think that's a wonderful statement. And I think, and actually one of the questions to come through is about the role of women. And you've mentioned your sister. I'm here because I'm championing this because my dad and women and partners and friends play a huge part in that. Do you mind sharing, Emeka, about the kind of role that your sister and you've played? And particularly, I think that we share for others, partners and others are really important and integral to this, aren't they?
Yeah, and I think you probably see it even in the workshop that we went to, other than men with lived experiences or clinicians there. I didn't really see any other men that were there who maybe had been affected, but there, you know, women were there as well in force. And even myself, I've kind of had to take the lead from my sister, who's been initially a lot more proactive than myself in regards to her own research and just doing a lot within the community to spread that word. But there's an element of, I'm speaking personally just for myself as well, of maybe, you know, fear as well. And not necessarily wanting to be caught up in certain things you think don't necessarily affect you right now. You know, I'll worry about that later. You know, I don't want to get too bogged down in things that seem a little bit morbid and all that kind of stuff. But it's so important. The message is so important. And just having loved ones, people that your sister, your mom, they can sometimes put a word in your ear that you know it's what you should be doing. But if you're just chilling with your boys, you'll get the same the same conversation,
Yeah.
the same rhetoric, but you get a different dynamic. So it's very important, I think, to have those conversations with important females in your life. And also just because it does also have that impact in regards to, you know, increased risk for ovarian cancer and breast cancer as well. So you mustn't forget that. Yeah,
absolutely. That's something that's always on my mind as well, given my strong family history. Patrick, what do you think the importance of partners and others play within this, particularly around encouraging people to come forward and be tested?
I think they have a pivotal role in all of this. Now, my wife died many years ago, so I did not have anyone with me. When I found out about my diagnosis, I was alone. And I wasn't meant to be copied into the correspondence that came from my oncologist to my GP. I just happened to be copied in by accident. It was a clerical error. And I read every part of that. And it was the most horrible experience of my life. I went numb. I couldn't believe. So I had no one to turn to. I rang up Prostate Cancer UK and spoke to one of the specialist nurses. And believe me, what went on there was amazing because they stood by me. After that conversation, I rang my big sister who lives in Florida, and we had a 2-hour conversation. The important part of that was, and she said, and I always remember those words, she said, in the absence of everyone, and that includes our mum who had passed away and my wife, she said, let us be clear, you are my #1 priority. And she made sure she went through every bit of the information and diagnosis. And there were things that she was able to tell me that I hadn't even thought of because I'm in it. I could not see the wood for the trees. But she could have those special eyes to look on this and be objective. That is one of the things that I learned, that partners and family members play a pivotal role, because without them, there are things that we are going to miss, the things that we're not even going to understand or pick up, and questions that we can ask our oncologists that we don't really think about. But one thing I'm going to say, because I know that you want to move on to somebody else now, is that there is a man who played a pivotal role, and I never told him this. I have West Indian background in me, right? Trinidadian to be exact. My father was Trinidadian. I went and I lived in Trinidad when I was 6. Born here, but went there. Most people do it the other way around. While I was here, I got involved with our High Commission, and a gentleman used to come there all the time, and he was Trinidadian as well. And he would talk about prostate cancer. Now that information sunk into me. Now this is a role that I'm extending from just partners to people who carry information. Now I'm going to name him because I think he needs to be named for the work that he did, right? And that gentleman's name was Suresh Rambaran, and he's online now. And he banged that drum about prostate cancer in West Indian men. Of course, I paid no attention at the time. This was just too much for me to handle. But then once I got diagnosed, it came all back, and I'm thinking, oh my God, had I listened to him at that time, I probably would have been better off, right?
Well, yeah, thank you, Patrick. I think that's really important, and we'll probably come back in the Q&A if we can, because a couple of key messages about where you had somebody who was sharing information, but you didn't take it on board in that moment as well. It's like all of us, isn't it? We're all doing our best, and some of it will land with some people. And like you say, you still have a memory. So thank you for sharing that. I'm going to, in interest of time, if it's all right, Patrick, I'm going to come back, because we are going to get the 3 of you in a room in a minute to answer some more questions that will be coming through. But I just need to hand over, if I can, to Amy Rallance, who's the Head of Improvement Care at Prostate UK, who's going to just share with us a few things. Amy, if I can just introduce you. Welcome.
Thanks very much, Karen. And it's really lovely seeing all of the interaction on the Q&A, and there are masses of questions coming in, which I think really emphasize that whilst the Black consensus is fantastic, and I'm incredibly proud that we've done this work, it's the beginning and not the end. There is so much more that we need to do in this space. And I just wanted to take a couple of minutes to highlight the key areas that we are working on in the next couple of months and years. So firstly, in response to several questions in the chat about screening, what are we doing about screening? We believe that it's wrong that at the moment, nowhere in NHS guidance does it acknowledge that Black men have double the risk, and that risk starts at a younger age. So we are working to change NHS guidance. So we have formally asked the National Screening Committee to look again at introducing targeted screening for Black men. Now that would mean that the NHS would invite Black men for a PSA blood test rather than Black men having to go and ask their GP. And as lots of people have mentioned in the Q&A, sometimes that's a really difficult ask. So we think that's a really important change. We don't know if the National Screening Committee will accept that, but we are lobbying very hard in that space. And, you know, failing screening, what we would like to see at the very least is a clear guidance change that makes clear that Black men are likely to benefit from PSA blood testing because of their increased risk. The second thing that I want to highlight is during the discussion that we had at the Black consensus, one of the things that came up a lot is that most of the evidence about prostate cancer screening is based on white men, and that Black men are very poorly represented in research trials. So we are a significant funder of research, and we are going to be changing our research criteria so that anyone who receives funding from us to do research is explicitly asked to focus on the recruitment and engagement of Black men, particularly in new research around screening and earlier diagnosis. And at this point, just to flag, because again, it came up in the Q&A, we do fund a research trial called Profile, which is designed to understand why Black men have a higher risk. So anyone who's listening to this, who's interested in that for themselves, for their loved ones, if you just Google the Profile trial, it's run at the Royal Marsden, find out a bit more about that. Thirdly, we hear a lot that our materials and messages don't connect in the way we would like with Black men. And, you know, a lot of discussion on the Q&A about how we can work with trusted groups to get that message out. So we want to work with Black stakeholders to co-create new resources that better meet people's needs, that we can share with those trusted groups, whether that's community groups, churches, whatever it might be, so that we can help them to spread that message. And related to that, we know that the vast majority of our awareness raising as a charity is actually delivered by volunteers, speaking in community groups, businesses and at events. Patrick is one of our volunteers, but we currently don't have a huge number of Black volunteers. So we're going to be really actively working to increase Black representation across our volunteer base so that we can really credibly raise awareness and drive engagement amongst Black communities. And finally, we intend to develop a diversity task force of Black partners and ambassadors who can really help us shape our plans, who can share their lived experience and can champion our work. And we can't do any of this on our own. We want to have a really strong dialogue with Black partners. We want to know when we're doing things right. We want to know when we're doing things wrong. And I think in the Black consensus, we were able to have that very honest dialogue, which I think got us to a great new conclusion in this work. I want to thank everyone who's helped shape our thinking so far. And in particular, I want to name check Frank Chinigwando, who chaired the Black Consensus for us, but sadly couldn't join us tonight. But I'm really looking forward to continuing this work, continuing this conversation. And on that note, I will pass back to Karen so that we can open up for some questions.
Thank you, Amy. And can I just personally thank PC UK, because I think for all of us in this room that have worked with the charity for some time, we think you're doing really great work. And it was a really great day to bring people together to have that opportunity to share their own personal journeys, as well as have that honest dialogue. And it was very honest. So thank you. I think it's really important, the work that you're doing. Thank you very much, Amy and team. All right, so we've got a few minutes left. We're going to open up to some questions. I'm hoping to get Amika and Bumi and Patrick back in the room with me as well, and Amy, obviously, so we can all sort of share a bit more dialogue, really. Thank you so much. I mean, I could talk to you all day. This hour is never enough, is it? It's like the beginning of what to me is just the tip of the iceberg when it comes to these conversations as well. And I think it's really important for us to say that I'm sure there'll be many more of these conversations. I've just got one question I didn't get to answer, and I'm going to pick up a couple that are coming through the chat. What else do you think you'd like to see happen to make sure Black men are aware of their risk? Now, I'm going to come to you, Bumi, first. Is there anything else that you think that we should be considering? What would you like to see?
Definitely, I think we should, and I'm really, like you, really happy for what PC UK is doing. And it's touching on what Amy said. I think we really need to look at the guidance now and what guidance we've got with evolving evidence. I think that messaging out to GPs and healthcare professionals should be such that it then empowers them even more to allow for testing. So I think that really should be looked at. Yeah. The other thing is looking at what role allied clinical staff play also. And it's interesting, I got that from the workshop, and even today, a lot of questions around access to GPs. But we know encouraging people to make informed choices, it doesn't necessarily have to be the GP. So again, that's something that I think PCUK can look at, and we can look at as a group. Patients have their new patient checks, they see the nurse, they see the nurse prescribers, the way general practice is now. There's the clinical pharmacist, there's the physician associate, and patients readily get to meet those people. So I think some form of education for them and some form of empowerment so that they can kind of give information to patients to make the informed choice, and the form for the PSA can be raised by them. So there's no delay around, I'm waiting for my GP. And that might be a way to look. They can signpost patients to the risk checker on PCUK also. And yeah, so it's not just the GP who then is able to do the PSA form, because they've had those discussions with the patient. The patient's made an informed choice, and then that form can be given to the patient. So that's something, again, to look at.
Yeah, I think all those points are well made, and it's great to hear that the campaigning of some of the changes in guidance, having worked at the NHS a long time, I think having this would really help many clinicians. Emeka, anything from you? Do you think, what else do you think needs to happen?
Yeah, so I definitely echo both what Amy and Bumi said as well. Just from my own experience, I've personally been to the GP on 3 separate occasions to get a PSA test, and each time I've been initially turned away, mainly due to my age, albeit the last time, which was after the workshop we held last year, I was better informed and able to eventually convince my doctor to agree to a baseline test to enable future trending. So even with the history of my dad, it takes a lot for me personally to initiate these sorts of conversations with the GP. So when you get told there's nothing to worry about and you don't need testing whatsoever, because you've not got symptoms or you're too young, it's very easy to walk away and think, you know what, let me not push that door any further. But on the flip side, when you do hear examples in the community, which we did hear, the workshop of men my age, even younger as well, being diagnosed and often too late as well, it's harder to ignore. So I just want that conversation to continue, also within the medical profession as well, for GPs, policy, guidance to be aligned. And so when people do pluck up the courage to approach their GPs, they're not just turned away because of their age. The GP's own power to have more informed conversations with them about their options.
Yeah, hear on that, Emeka. And I think that no GP should turn anyone away. And now we've got the statement, that should be definitely something they can use to support that conversation. But yeah, it's really hard. Some people would never go back. So well done for you for going back and persisting as well. Patrick, last few words from you before we close, if I may.
Right. That issue with GPs is not only down to young people or to people that are younger. I was 63 when I went to get my PSA test the first time. And I had to run the gauntlet of working out, convincing the doctor as to why I needed to have a PSA test. I was healthy and I was moving around. 63, I'm a Black man. My GP knew that my mother died from breast cancer, that my grandmother died from breast cancer. My GP knew that my father died from prostate cancer and my grandfather died from prostate cancer, right? No one even thought of doing a test to see if I am carrying the BRCA gene. Only after me pushing and knocking on that door that they gave me the PSA test. And when it came, well, actually, I'm jumping the queue. I did this in October, the 9th of October, 2019. My results for my PSA was only given to me on the 15th of December, 2019. Now, there is no way that a PSA test takes that long. I was forgotten, completely forgotten in the system. And then when they saw it, it was so high that they were all flapping. Then it was decided to do that genetic test to see if I was carrying the BRCA gene. And it turns out, yes, I was carrying the BRCA2 gene. I already have sons and grandsons, right? This is a problem for me. This could have been alleviated much earlier in the system, but it wasn't. But you know what? I'm here now, and I'm here where it is. I am well informed, and believe me, right? What they have unleashed, they have no idea what's coming their way.
Well, I think it's a real blessing, Patrick, because what you are doing is sharing your experience with many, many people, and you're making a huge impact to other people's lives. So, and all of you, Amy, Bumi, Emeka, you're all doing some fantastic work. And I, for one, I'm really grateful for you being here today. I could talk to you forever, but sadly, we've only got a few minutes left.
I know.
So if I could just thank each and every one of you. I've got a couple of closing remarks, if I may. So thank you, Amy. Thank you, Bumi. Thank you, Patrick. Thank you, Emeka. Thank you for joining me. Yeah, and I hope we have another conversation, because I think there's probably more for each of us to share and more for us to say. Thank you very much. So a couple of things from me before we do close. So there were a couple of questions I think that came through that we are able to respond to if you email. I believe that some details have been put into the Q&A chat. If there's anything that hasn't been answered today that you would like to be answered. With prostate cancer, they've got their specialist nurses. The details are on their website should you need any further information. And if you obviously want to hear anything more, there's also a link in the chat to the newsletter that you can hear further information updates. And I think keep yourself informed, because clearly there's lots more work to be done as well. And I think that the Prostate Cancer UK have got many things on their website, including the checker, which is very quick to do. I would really advise people to do that if you're not sure, you're unsure, or you're a loved one and want to do that with your loved one. The checker is really, really quick and easy to do. So there's lots of information on there should you need. I hope that this has been helpful to many of you today. I really hope that you rejoin us in the future. keep the conversation going, go onto the website, get the statement and use it and ask for the things that we've discussed. It's really important for you all to remember the census, that you can ask from the age of 45 as a Black man for the PSA test, and therefore it is available to you, and you can use the statement should you need any further conversation with your GP. And if you've got a strong family history of ovarian cancer or prostate cancer or breast cancer, we encourage you to do that at any age. Thanks once again, thanks to PC UK, and thanks to everybody for taking your time out this evening and joining us this evening. Thank you very much for everything. Have a good evening, everyone.